This short video has been produced by the Dublin Dental University Hospital to demonstrate the steps involved in the reprocessing of reusable invasive medical devices, or RIMD, for their reuse in a dental practice. These steps also apply to the decontamination of all RIMD in primary care local decontamination units, including general practice and podiatry services. Decontamination and sterilisation processes are based on the Health Service Executive Standards and recommended practices for decontamination of RIMD in a local decontamination unit. All dental practices that provide services for the HSE must meet these minimum standards. The Health Information and Quality Authority, HIQA, has developed national standards for safer, better healthcare to describe what is required of a high-quality, safe service. HIQA require healthcare providers to have structured systems in place. These national standards were developed to control and minimise the risk of infection to patients and staff. Improving the quality of care and providing a safe working environment are fundamental activities for the HSE. One of the key factors in ensuring quality standards in a healthcare environment is the reprocessing of RIMD. Decontamination involves a combination of specific processes used to render RIMD safe for handling by staff and for subsequent use on patients. Effective decontamination of RIMD is an essential component in the prevention of healthcare-associated infection. It is critical that site-specific operational procedures are developed for each zone of the local decontamination unit, or LDU. This should consist of a combination of the HSE standards and recommended practices and manufacturers' instructions. These procedures are essential to ensure quality control, efficiency and to reduce system variation. The process of decontamination consists of three principal components. These are cleaning, disinfection and sterilisation. Cleaning physically removes soil or debris from RIMD, including large numbers of microorganisms and the organic material they consume as a source of food and energy. Disinfection causes a significant reduction in the number of viable or living microorganisms on inanimate objects, but is not as effective at reducing the density of and killing of bacterial and fungal spores. Sterilisation refers to a physical or chemical process that completely destroys all forms of viable microorganisms from an object, including spores. The decontamination life cycle highlights the extent to which decontamination affects the organisation of the entire dental facility and not just the areas where RIMD are processed. Once RIMD come in contact with blood, bone, saliva and human tissue, they become contaminated. The decontamination life cycle process must be followed before the RIMD are used. This is the sequence that all contaminated RIMD in the dental surgery are required to follow after the RIMD have been used on patients. Effective decontamination requires the attainment of acceptable standards at all stages of the life cycle. Failure at any stage may result in inadequate decontamination. The 10 steps of the decontamination life cycle for RIMD are 1. Acquiring a medical device. 2. Cleaning. 3. Disinfection. 4. Inspection. 5. Packaging. 6. Sterilisation. 7. Transport. 8. Storage. 9. Use. And 10. Transport. The Local Decontamination Unit, or LDU, of the Dublin Dental University Hospital was designed and constructed according to the HSE standards and recommended practices for decontamination of RIMD in a local decontamination unit. The floor plan of the LDU highlights the locations of the traffic light flow system, beginning with the red zone, then the amber zone, and finally the green zone. In order to achieve the 10 steps of the decontamination life cycle, it is best to design the local decontamination unit with zones similar to a traffic light flow system. The first zone is the red zone. This zone is the first point of contact in the LDU for reusable invasive medical devices, i.e. dental instruments, after they've been used on the patient. This is the most contaminated zone of all 3 zones. The next zone is the amber zone. Here instruments have been thermally disinfected but are not sterile. This zone should only be used to inspect, pack and prepare instruments for sterilisation. The last zone is the green zone. This is the zone from where instruments are released following steam sterilisation in an autoclave to the storage area before being used on a patient. In this video, we will accompany an appropriately trained dental healthcare worker through the steps of the decontamination life cycle. The first step of the decontamination life cycle is acquiring a medical device. This is the purchasing of the dental instrument. The manufacturer is obliged to provide information on the use, function and the processes to be used for cleaning, sterilisation and, if appropriate, the dismantling of the instrument. Before any device or instrument is purchased, ensure the decontamination process recommended by the manufacturer is compatible with the existing decontamination processes used in the LDU. Ensure all devices have a CE mark. This means that it conforms with European Union standards of safety. Single-use items cannot be sterilised or reused following their first use. Reuse of single-use items compromises the integrity of the device, and if they're used a second time, the product liability for its performance is then transferred from the manufacturer to the dental healthcare worker. The device is no longer fit for the intended purpose, and the user assumes all legal responsibility for any potential adverse effects arising from reuse, and is liable for sanction and/or prosecution under EU and national legislation. Once instruments come in contact with the patient, the dental team or the environment, they are contaminated. After the patient leaves the dental chair, it is the responsibility of the dental healthcare worker to dispose of sharp items before cleaning the area and removing contaminated dental instruments from the dental chair area into a contaminated instrument box. Contaminated RIMD should only be transported to the designated decontamination unit or area in a closed container. This transport container should be lockable, so the lid cannot open accidentally, and should be clearly labelled with a biohazard symbol. The contaminated instrument box is placed in the designated receiving area in the red zone. It's important that the dental healthcare worker carries out hand hygiene according to the World Health Organization My 5 Moments for Hand Hygiene protocol. This sequence includes rubbing hands palm to palm, in between fingers, backs of fingers, thumbs and nails. Full guidance is available on the World Health Organization website. The dental healthcare worker then dries her hands thoroughly with disposable hand towels. Using the hand towel to turn off the taps and then dispose of the hand towel in a domestic waste bin, using a foot-operated pedal to open the bin. The dental healthcare worker puts on personal protective equipment, PPE. The PPE includes a full-length disposable gown, a disposable surgical cap, a full-face visor and disposable non-sterile gloves with extended cuffs. These gloves are Category 2 gloves, which offer a higher level of protection than regular examination gloves commonly used in the dental surgery. This is the required dress code for personnel working in the red zone. A disposable visor is the best option to protect the face from splashes. This PPE should never be worn outside the LDU.